I was actually looking for dentists for shadowing, and I logged on Google and did what most people do. They searched up dentists in my area. I live here in Lewisville, I'm a Lewisville native, and I noticed that this office actually had really good reviews, and so I really liked the website page and everything. So I was like, you know what, it wouldn't hurt to give them a call. So I kind of called up here, met Dr. Matthew. I started shadowing, and along the way, Dr. Matthew actually was like, you know, you have a lot of drive and I know that you want to go into dental. So she's like, how about if we did some dental assisting courses? She's like, I actually offer them here in the office. So I thought that was really awesome, like doing one-on-one with the doctor. That's actually why I ended up doing it here in the office. And when the doctor asked me if I was interested in doing dental assisting, I thought that was a really good opportunity for me to test the waters and see if I truly wanted to pursue this career. Shadowing, I mean, obviously gave me some experience, some look into the dentistry world, but dental assisting definitely gave me a better idea of the business side, basically how the rest of the staff works, how all the components come together. So with that, it kind of I was interested in seeing that side of dentistry. So I was like, you know what, let's go ahead and do it. And when I started dental assisting, I realized that, you know what, this is where I want to be. So it definitely did help me want to pursue dentistry even more. So it fueled that passion that I had already. Dental assisting really opens up your opportunities getting into dental school or even a hygiene program. As a matter of fact, in my application cycle, I was talking to my advisor and I was asking her, what's the difference between shadowing and dental assisting? She's like, well, shadowing, you're observing the doctor do their work, and you only get small time from small windows of being able to see certain procedures. You don't get to see the full scope of everything. So with dental assisting, it's considered more valuable actually for the programs because you're getting real life clinical experience when you're actually doing stuff. So I think it definitely does give you a stronger application for sure. So I actually have friends who are in for example, community colleges pursuing or specific dental schools where they do dental assisting. And one thing that a lot of them mention is they don't really get patient interaction. They mostly practice on each other. So it's very scripted, it's not in a raw environment. And I feel like here you definitely get exposed to patient interaction. So I actually enjoyed that, and also the working one-on-one with the dentist. In a larger class, you might have 20 students in a class, versus here it was much smaller groups and smaller environment where I was able to ask the doctor questions and be able to kind of go with her step by step on every procedure. So I really enjoyed that. Basically, I would come in once a week, very relaxed. I'd come in not too, the doctor basically said we can set up something that's not super early, that kind of works with your schedule. And so we decided on 1 week on Fridays at 10 in the morning. So to come in, we do a little bit of practice, go over the material with the doctor. We might have a quiz or something from the previous material. And then we do the clinical portion of it. So we'd go over the actual concepts of whatever procedure we were looking at. And then we'd kind of go over the actual materials that we were using, or she'd kind of let me shadow in on a patient that we were doing a procedure on that day. So I was able to observe the actual practices that we were learning in the dental assisting course being actually brought to life in the office with a real patient.